Take you straight to the Western Cape, and that's where Premier Alan Winde is today launching a dedicated violence prevention unit in the province's Department of Health. Now, the unit will use data from healthcare facilities to craft a tailored initiative aimed at combating gender-based violence. And that's where we find Newzroom Afrika's Nasiphi, who joins us now. Nasiphi, good morning to you. Another annual observance of 16 days of no violence against women and children. How important is this initiative that's being launched by the Premier today?
Well, Xoli, where we are currently, where the launch will be taking place, is Delft, one of the communities that usually not only factors or features on the national crime stats, however, provincially as well, ranking up quite high nationally as well, in the top 20 of the policing precincts that contribute towards gender-based violence cases. And basically, as you put it, a bold move by the Western Cape government, where we will see now a launch of the Violence Prevention Unit, data-led, and basically we understand that this will be rolled out throughout the province. But to talk to us more in regards to the Violence Prevention Unit, I'm joined by the Premier. Sir, thank you so much for your time. But where we are currently, Delft, which features not only provincially but also on a national level as contributing to gender-based violence, talk to us about this Violence Prevention Unit.
So I think before I get there, I want to say I think that's exactly what one needs to do. You have a look at where the problems are, and you must zoom into where those problems are. Now, we have, since the beginning of my term, focused on the safety plan. Initially, it's about boots on the ground and policing. We don't have enough police officers, men and women, in our province. I think we've got 16,000 now. We should have 25,000 at least. And we're topping that up, and we're calling for changes in management. But it doesn't help only policing from the one side. You've got to go to the causalities. Why do we have such high levels of gender-based violence? Why do we have high levels of interpersonal violence? Why do we have so many murders that take place within families? We've got to get to understand that. And the only way to do that is saying, well, let's focus on the data, let's focus on the evidence, let's zoom into where it's happening, let's pull in the partners, and let's have a look at how we can get this right. Let's go and learn from other parts of the world. So we've learned from what we call the Cardiff model. I've also been to Glasgow, the Glasgow model. And violence prevention, it's about a whole mix of things. The first 1,000 days of a child's life sets you up for the rest of your life. Understanding, using that data, as you said in the introduction. What is the data? We've got trauma measurement in our hospitals, and we manage trauma. We look at it, where does it start? We use that data for deployment of officers, but now we need to use the data to say why, and we start to fix the problem slowly but surely over time. These are not quick fixes, but they are saying let's be very serious about crime. Let's be very serious about fixing it.
I'm assuming this is a model that was used during COVID-19 with the tracking.
Yes, the Hector system, we used that to track the COVID as well. It was our violence tracking system, and it's now rolled out to all of our health facilities. So when an ambulance picks someone up, brings them to the trauma unit, we know that they had perhaps was a stabbing. And we then say, well, GIS map it, where did it happen, what time did it happen? It's not police data, this is health data. What was the cause? And so we use that mechanism as one of the tools. We've got to use a whole range of them, but as one of the tools. That's the Hector system, which we're very proud of, and I think the team at the health department have done incredibly well. And violence prevention, we're housing within the Department of Health. And sometimes people go like, but why there? But it's the Department of Health that deals with the consequences of crime. And so it is a great place for measurement, and it's a great place to say, well, you've got to be one of the partners. And of course, we're here in Delft, but we're at an amazing facility that is one of our other partners, which is the Bavarian government. And, they've invested here, and it's a great place to begin. So then when the Social Development Department comes along, they then also say, well, let's bring our social workers and base them here as well. And so we start bringing those partners together to build a safer and better environment. And what better place to do it than in a place where we've got actually really bad statistics, and we can see that let's move that needle.
When can we see this particular unit being rolled out? And I'm assuming it will be throughout the province.
So it's already in place. In actual fact, you would have seen in the last 2 to 3 months some of the positions being advertised and filled. So we've now got people. And of course that's the most important thing, is you've got budget and then people. So the budget came in place, now the people are coming in place so that we can actually start to make things happen. So I'm sure that you'll hear the different ministers announcing what they've done, how those people have been deployed. So that's within the unit itself. But then it's also about the other parts of the unit. So you'll hear from social development, they will say, well, because we gave them extra money in the budget to say, now you need to appoint new or more social workers, but you've got to make sure that at least half of those social workers are going to the hotspots. Which are the crime hotspots? This is one of them. They need extra social workers because that's also about how you build the trust in the system. It's going to be really critical that we get the neighbourhood watchers on board. The local business chamber, they've got a role to play. It doesn't matter who it is, they all become partners. Every single citizen is going to become a partner over time, and we've got to build trust with the citizens. We've got to show them that these interventions work, and slowly but surely we will change the environment.
Premier, how much does it take to run a unit like this?
In funding?
In funding.
Well, I'm sure they're going to tell you lots and lots and lots. We put a few million together in the beginning. And we've got to also try it. We've got to see how it goes. And then once it's running, you will have a look and say, no, we need to increase here or decrease there. It's the exact discussion that we have to have every single financial year beginning. But it's interesting because we're doing this in a time where we are actually having severe cuts as a government. The National Minister announced the outlook for the next few years, and we are feeling the pressure. We're feeling it in education and health, which is our big expense items, and we're having to have huge cuts, and we're going to have a lot to say about that over the next couple of days, because it's actually unaffordable when at the same time the stats are showing us, like crime here, crime's going up, we should be putting more and more resources in. And then education, we're giving more and more opportunity, but more and more demand. We've got people moving here from all over the country to come and get education or to come and get health care, and at the same time we're having our budgets cut. It's really tough. But we've got to make those hard choices, and violence prevention is one of them we've got to fund, and we've got to make sure, because we're trying to look forward into building safer societies.
Western Cape Premier there, Alan Winde, will have to leave it there as is about to launch the Violence Prevention Unit here in Delft. And I'll just take you to those crime statistics that were released, painting a very grim picture of Delft in particular, saying that Delft in the fourth quarter of the 2022-23 financial year, it actually ranked number 8 nationally and number 1 in the province as the highest number of gender-based violence and sexual offences reported in this particular community. So quite important that Violence Prevention Unit is launched in a community like this, as we heard, that the unit will be rolled out provincially.
Nasiphi, live for us there in the Western Cape, a launch of a very, very important unit, and you heard them speak about crime in the country. Well,